My name is Dr. Amrita Yanamandra. I'm an ambassador for PAN India. PAN is a global NGO. It stands for Physicians Association for Nutrition. And the mission of PAN is to eliminate diet-related deaths by making nutrition as the core of the healthcare system. And we are involved in creating awareness amongst the doctors, the allied healthcare professionals, and also the public. Now, we all know worldwide women are affected by gynecological disorders, a spectrum of these disorders, and they are a significant source of morbidity, causing bothersome menstrual problems, infertility, other issues, and also affecting the mental health of the woman. And sometimes just treating it with medication may have a temporary effect, or they may need medication for a very long time, or some medications have undesirable effects, and that affects the compliance. And sometimes these disorders become quite chronic. Understanding the role of nutrition in gynecological disorders will change the way we manage these diseases in the women. And a classic example is PCOS, where the lifestyle changes do help the patient in getting better. So I'm going to give a brief introduction of Dr. Meera Ragavan. She's a senior consultant urogynecologist and a robotic surgeon practicing in Apollo Hospitals, Chennai. She's a secretary of Chennai Menopause Society, an executive committee member of OGSSI, and a core committee member of FOGSI. She's also a core committee member of various other societies in OBS and Gynae. She's also MRCOG trainer and examiner, and the director of ASCOT, which is the Apollo Simulation Critical Obstetrics Team Training. And she's won various gold medals during her undergrad and postgrad time. And she has several publications in national and international journals. And again, it gives us great pleasure to have you here, ma'am. Over to you.
Thank you very much. Thank you, Amrita and Pan, for having me here. So before Dhanteras and Diwali, to start the whole webinar, we have got the whole thing wrong about Dhanteras is Dhanvantri Jayanti, and the true wealth is actually health. I'm very glad we are doing this with women, promoting health for women through nutrition. We should be celebrating health, which will beget wealth, not the other way around. And I'm so glad we're doing this on Diwali Eve, prior to the whole festive session. So we all choose mindfully what we're going to eat as well. If I may share my presentation. So the whole thing is about evidence-based approach to nutrition or nutritional approach to gynecological disorders and supporting women's health through nutrition itself. So various gynecological disorders we women face, and it's very important to understand and appreciate the fact that majority of them are lifestyle-based issues and not necessarily need medical intervention unless there is a significant impact on health as such. And these are globally present, and consequences will include heavy bleeding, pelvic pain, prolonged periods of anovulation, imbalance in their male type hormone in the body, and their cosmetically as well as endocrinologically, and fertility issues, and increasing the morbidity and mortality of women as well. Short-term effects are based on medications. They do have their side effects, and the side effects can be serious ones, like ones on the liver, which are by the contraceptive pills, or even clotting mechanisms causing them thromboembolic events in women. And they also seem to interfere with pregnancy and are not permanent and there can be illness recurrences. So, underlying the basic pathophysiology is crucial for us to maintain what we call disease-free interval or sometimes even reversal of the disease process. So, health and diet. If I use the terminology diet, I make it very restrictive. So, I'm happy that we have chosen nutrition. And these are very complex because not much research have been done into these aspects, and they're not large numbers on which that this is going to work for sure. And there are conflicting evidences as well. Research suggests avoiding gynecological diseases with fruits, vegetables, green tea, vitamins, and plant-derived chemicals. I want to emphasize a particular fact that these should be the choices for every meal rather than in addition to the meal choices we make. Many people think I take green tea, I take these vegetables, I take these plant derived nutraceuticals, but I have my regular meal which comprises more than 70% carb. That's not going to work. Nutritional impact guides dietetic as well as treatment paradigms. So we have to emphasize the fact and reiterate the fact that the nutrition which we advise these women are for life and not just for till the time you achieve what your goal is and go back to your default. These problems are going to come back. So these are two important aspects we need to make. And this is a kind of a total change which has to come from within, and the whole thing has to be internalized by women for their life. So whole grains and nuts are rich in minerals, vitamins, and fibers and phytochemicals. And we have emphasized the fact that nuts are healthy fats to reduce the abnormal distribution of fat, which is obesity, where it is not to be. Fat is not bad. Being in the wrong places is bad. So diabetes and cardiovascular disease, and fruits and vegetables are antioxidant. Lesser the cooked ones, the raw the plant source gets, so closer to the plant source you get. That is what needs to be in predominance in our nutrition, which is why processed and ultra processed foods are going to enhance inflammation and cause various gynecological disorders. This is something we need to understand as basics. With regards to protein from animal proteins, it's high protein and saturated fatty acids, and fish provides protein, minerals, and omega-3 fatty acids. And we know that green tea has antioxidants and anti-tumorigenic properties. What is the role of diet, nutrition, in oxidative stress and inflammation? These dietary constituents actually have an interplay between oxidative stress and thereby inflammation risk. We know high carbohydrate content, high fat diets promote or enhance oxidative damage and thereby cell destruction and alteration in the cell metabolism. And excessive meat protein can cause toxic gut metabolites and cause significant dysbiosis in which is a self-propagating issue regarding pro-inflammatory state in women. So the dietary influences can be got from minerals as well, like for example, selenium. It affects the eicosanoid synthesis as well as the inflammation and blood pressure and immune regulation. Early pregnancy may increase pregnancy-induced hypertension risk if there is a deficiency of the selenium. We also need to understand more about the food pyramid. We need to take whatever is in base of the pyramid in higher quantities, and as we reach the top of the apex of the pyramid, the rarer food groups come in, which are actually calorie dense in nature. So if you look at the base of the pyramid, we have calorie rare foodstuffs. And as we climb up the pyramid, the food on the top is calorie dense food group. We need to understand the fact that our body composition is 70% water. So we need to increase the amount of water intake every day, depending upon the weight and the activity and the climatic conditions as they dictate, and not one size fits. We do not shop for nutrients or micronutrients. We shop for food groups. So it is important we understand that fiber as a macronutrient is available in naturally occurring whole grains, fruits, and vegetables. Compared to vegetables, fruits are slightly higher in their sugar content and calorie dense nature. Whole grains are preferred to processed or ultra processed or polished grains because they contain fiber and protein in addition to the complex carbohydrates, whereas the ultra processed ones are purely carbohydrates and especially starchy and simple sugars in nature. The lean meat, the fish, the tofu, the seeds, and the nuts are all sources of healthy protein. And similarly, dairy and dairy products also give us that healthy protein in turn, which is about 15% of what we need to be ingesting. 10% should be healthy fat, and that comes from monosaturated fats rather than the trans fat or completely saturated fats. It should be a combination of various oils rather than just butter or animal fat. I also want to emphasize on the various dietary fads or dietary regimens people claim to be effective. Yes, they might be effective, but are they sustainable? Are they without any adverse effects on your gut microbiome, which is the in thing nowadays, which is the reason behind significant inflammatory processes, which are the underlying causes of various problems. So if you look at this Venn diagram, you can see the difference between the paleo and the keto diet in that the paleo allows all type of fruits. You're not allowed fruits in the keto diet. You can have your sweet potatoes and the starchy veggies like beets in the paleo. You're not allowed that in the keto, and you're allowed natural sweeteners. Whereas no grains or no beans and legumes. Legumes and beans, though they are source of carbohydrates in them, but the ones which are not peeled, ones which are not polished, have the fiber content as well. The high quality meats form an essential part of both paleo and keto, the paradigm of both the diet patterns, and non-starchy veggies, which are more watery in nature or fiber in nature. And healthy fats such as coconut oil or lard, it is not allowed any other fat. And the keto diet primarily encourages more dairy products like cheese, yogurt, paneer, etc. I'm also going to give you an insight into the various diets which are being followed for polycystic ovarian syndrome, like low versus low carb. It depends upon the carb quantity versus the quality. Low carb reduces the carb quantity to literally less than 35%, whereas low GI focuses on the carb quality. You can change the carb quality of your plate by combining certain foodstuffs which will reduce the GI content. And unknowingly, you can increase the quality of the carb by mixing certain foodstuffs, which automatically puts up the GI, which is the glycemic index you derive from your plate. Low carb counts daily carb grams to stay below recommended low carb amount, whereas low GI encourages food selection based on the glycemic index ranking. We know that low carb leads to significant improvement in blood glucose levels, whereas low GI foods can contain up to 10 spoons of sugar, and all carbohydrates raise blood glucose levels. Apart from these type of diets, which have varying names, I'm also going to give you an insight into the difference between intermittent fasting and time-restricted eating difference. So why time-restricted eating and intermittent fasting? Time-restricted eating is a version of intermittent fasting, except that the fact that the time-restricted eating window happens during the daylight hours. So it aligns with the biological circadian rhythm, improves sleep, which itself is a reparative and restorative process, thereby supporting healthy blood lipid levels, reduces the insulin resistance, creates better homeostasis with the glucose metabolism, reduces the resting blood pressure, and also stimulating autophagy. So eating over an extended window of time and frequent change in the early dieting window is pro-inflammatory in nature and disrupts the metabolic equilibrium in the body, predisposing to various metabolic disorders. Whereas if we stick with a consistent daily window of less than 12 hours, there is improved immunomodulation, lesser inflammation in the body, and thereby improved metabolic homeostasis, reducing the chances of metabolic syndromes in our body. Does the time of day you eat matter? It is preferably better to stick to sunrise and sunset as to start and stop the eating window, beyond which definitely there are metabolism slowdown, not very good digestion process, and there will be disturbances in sleep as well as increase in the blood pressure due to higher cortisol levels. So given this preamble, let me go through the application of nutrition in each and every gynecological disorders, which we commonly see. We know polycystic ovaries, I think now it will be affecting more than 20% of our women, especially in the adolescent age group, and is associated with insulin resistance, can be a precursor for type 2 diabetes, early onset gestational diabetes, obesity, hypertension, metabolic syndrome, hyperandrogenemia, and endometrial cancer. Causes are unclear, mainly related to lifestyle and dietary influences. Or modification in nutritional therapy reduces the insulin resistance, which is the prima facie problem in polycystic ovarian syndrome, and causes betterment of the reproductive dysfunction. Weight loss is paramount. Even 5% to 7% weight loss improves patient and the chances of spontaneous conception in patients with polycystic ovarian syndrome, alters the metabolism of fatty acid, and adequate intake increases reproductive activity. The more the insulin resistance in PCOS women, they are known to be highly prone for vitamin D deficiency compared to non-PCOS counterparts. And omega-3 unsaturated fatty acids reduce insulin-resistant PCOS risk, and vitamin D influences metabolic pathways, including insulin signaling pathway. So suboptimal level of vitamin D not only are associated in patients with PCOS, may be contributory factors to insulin resistance and PCOS pathogenesis. So vitamin D is very, very important to be considered, especially if they are deficient, to be supplemented in patients with insulin resistance alongside PCOS in obesity as well. So what does impact of vitamin D do to women who have PCOS? It reduces the insulin resistance. It also downregulates anti-Müllerian hormone promoter, And vitamin D supplementation lowers the AMH levels. And high insulin levels increase testosterone production in the body in patients with PCOS. So low carbohydrate reduces the metabolic and the reproductive disorders. PCOS, apart from weight loss, when you're altering nutrition, you should think of omega-3, low carbohydrate diet, which is less inflammatory, less water, which also improves insulin sensitivity, and vitamin D supplementation if they are deficient, and exercise, which is a most important insulin sensitizer. So what are the natural anti-androgen foods for PCOS? Soybean, especially soy milk. So altering your dairy products to soy products will be a very good idea because soybean cholesterol, anti-androgen, good for protein, avoids the lactose intolerance, avoids the bloating, avoids the metabolites which comes on with the dairy milk like estrogen, and thereby reduces the inflammatory state which can be happening in PCOS. Green tea and licorice are natural anti-androgen foods used in PCOS study, known to decrease the testosterone levels after 3 months. A cup of soy milk every day for 3 months is known to reduce the testosterone levels. And green tea, as we've seen earlier, promotes insulin sensitivity and lowers the testosterone. Licorice, because of the aldosterone pathway and its effect on the aldosterone pathway, elevates PCOS symptoms and reduces androgen excess, which is there in the PCOS. Flavonoids as mediators in PCOS, we know that quercetins are antioxidants, anti-estrogenic are very, very important. It reduces the androgens and insulin resistance in rats, and daily doses elevate PCOS features. Other flavonoids regulate steroidogenesis, metabolic parameters like lipid profile and LFTs, reduces the incidence of ovarian cysts, and enhances follicular development according to the cycle. Are there any minerals and what is their role in PCOS pathogenesis? Chromium, we know that it is in combination with various other nutraceuticals in medications which are given for people with polycystic ovarian disease. It is a cofactor which enhances glucose metabolism. It improves the glucose tolerance in PCOS patients and may decrease hirsutism and improve PCOS symptoms as well. Calcium has a definitive role because of its internal milieu effect, and vitamin D receptor linked to calcium homeostasis. And calcium supplementation with vitamin D and metformin is known to improve fertility rate in women with ovarian syndrome and fertility issues. So selenium also needs to be added in patients with polycystic ovarian syndrome, and its insulin-like activities as well as the lipid metabolism. And it's also important for us to understand that zinc is key in insulin resistance at PCOS, and low magnesium and high testosterone levels associated with PCOS pathogenesis. And sleep disorders are also associated with low magnesium. So, and Charlie's horses, which people get as cramps in the calves, are because of magnesium deficiency. This is also known to be alleviated with magnesium supplementation. So this is just to show what the various impacts of nutritional alterations, the role of diet in the underlying biological mechanisms of PCOS. The DASH diet reduces the insulin resistance, has also an impact on the BMI, as well as the triglycerides, and increases the glutathione. Vitamin D reduces the BMI and the hip circumference, reduces hirsutism and the free androgen index. The inositol, which people nowadays use significantly in combination with other factors, also reduces insulin resistance and enhances improved ovarian function, hence the use of myo-inositol in patients with fertility issues. Seed cycling is known to improve the abnormal cycle patterns which happen in women with polycystic ovarian syndrome. We start with 1 tablespoon daily of pumpkin seeds, alongside flax seeds 1 tablespoon daily in the initial follicular phase, which gives the estrogen boost. And subsequently, in the second half of the cycle, beyond day 14, it is added with, it is supplemented or replaced with sunflower seeds in the same quantity and sesame seeds, because it has the properties of enhancing lignin synthesis, which enhances or regulates progesterone synthesis, which is otherwise deficient in polycystic ovarian syndrome. And the seed cycling has been proven to reduce various inflammatory markers, waist circumference, triglycerides, as well as abnormal liver function tests, and even fasting blood sugars marginally in patients with polycystic ovarian syndrome and metabolic disorders. So these are the elements which are present, or the constituents in these particular seeds, which are helpful when cycled properly through in alignment with the follicular phase or the luteal phase, so as to get proper cycling and regulation of cycles duration for polycystic ovarian syndrome. So people who are averse to taking meds and hormonal pills should definitely tie this alongside the dietary adjustments and exercise. So this will be helpful and reduces the frustration for these women. So just to give you the various studies which are there, PCOS ameliorates the effects of all 4. So flaxseed, what all it contained, and it's a randomized controlled trial which is about this. And at least for 3 months would be better for to try the seed cycling for these patients. Now moving on to endometriosis, again, a pro-inflammatory status and a hormonal disorder. Endometriosis is a condition which is chronic, persistent, recurrent. So remember CPR for endometriosis. Whatever you do, it's chronic, it's persistent, it can be recurrent. So we'll have to keep managing in some way or other. And we have moved away significantly from being knife happy or laparoscopy happy for endometriosis. Try to avoid the surgery, and the first surgery should be the best surgery in taking out as much endometriosis as possible, because we know it is recurrent. So it's an estrogen-dependent gynecological disorder where there is outside uterine cavity endometrial cell proliferation. Symptoms include pelvic pain and infertility, and diagnosis delay can be as great as 11 years, especially if you miss the pubertal dysmenorrhea, dismissing it off as something which is naturally happening at the time of puberty. If a patient has pain beyond the period cycle, has pain throughout the cycle, has excessive bleeding, has pain during urination or defecation, that has to be investigated thoroughly by proper imaging. Otherwise, it could be a very bad endometriosis, especially if it is in the pubertal age group. Rule out an uterine anomaly, because that could cause secondary endometriosis due to blockages in the anatomical pathway of the reproductive tract, thereby causing backflow endometriosis. So pubertal dysmenorrhea should not be dismissed and has to be investigated so as to avoid delay in the diagnosis and proper institution of treatment. So it involves both genetic and immunological pathways, inflammatory reactions, and environmental factors. So fruits and vegetables, because of their anti-inflammatory nature, are known to be possible protection for endometriosis. Similarly, vitamin D, because of its downregulation of the inflammatory markers. We tend to ask them to avoid red meat on a regular basis because of the possible increased risk. Similarly, reduce amount of chicken because it contains more antibiotics and estrogen. Antioxidant effects of vitamin C and E will help endometriosis. And less resveratrol reduces the pelvic pain and dysmenorrhea, and reduces the aromatase and COX-2 inhibitors. So is there a role of omega-6 fatty acids? They can cause inflammation and endometriosis. So trans fat should not be there and should be avoided, whereas omega-3 supplements can decrease endometrial implant growth and inflammatory factors. Vitamin D, as already seen, regulates and downregulates the inflammatory cytokines and can cause lesser dysmenorrhea. N-acetylcysteine can reduce the inflammation and alleviate endometriosis. We commonly use this in patients with hepatitis or in patients with metabolic associated fatty liver. And this is the same principle in which it acts in endometriosis as well. These are other micronutrients which can help, but has to be regularly supplemented. So we need to understand that reduce 6 by reducing trans fat, increasing omega-3, using more cruciferous vegetables. So what are cruciferous vegetables? All those which belongs to cabbage, broccoli, lettuce, those are cruciferous vegetables in good amounts. By increasing their antioxidative and anti-inflammatory process will help endometriosis. These are some ways by which modulation in the dietary intake can alleviate symptoms in endometriosis. Moving on to the importance of vaginal microbiome and its impact on the gynecological disorders now. This is known to involve sexually transmitted infections, and where there is an overgrowth or an imbalance can cause bacterial vaginosis. Bacterial infections can itself cause pregnancy losses, low birth weight, preterm babies, cervical cancer, ectopic pregnancy, infertility, and so on and so forth. And that is very, very important. And we know that higher bacterial vaginosis are associated with vitamin D deficiency. And in certain ethnicity, it's more common, like an Afro-Caribbean population. And that is because of the vaginal microbiota are more likely to be colonized by specific bacterial vaginosis associated bacteria. So increasing the lactobacillus in the diet will tilt the balance towards healthy microbiome. Whereas if you have a high fat, high sugar diet, that will increase the vaginal pH. Normally the vaginal pH is acidic. If we increase the vaginal pH by high fat, high sugar diet, you are making it prone for bacterial vaginosis because there is no defense mechanism against the abnormal bacteria which are going to be there. The same reason why nutritional approaches are very important for premenstrual syndrome. We know that calcium and magnesium supplementation reduces the severity of PMS, like fatigue, cramp, depression, and fluid retention. Carb intake reduces the water retention, which can happen in the premenstrual period. The craving can be reduced by low carb intake and increasing your fiber intake. The bloating can be reduced by having frequent meals and avoiding high starchy or high sugary substances. So PMF relief by magnesium supplements is known to be evidence-based, calms the nervous system, as well as reduces the cramps, which can happen in the lower abdomen, as well as the calves. And vitamin B6 is known to aid further elevation of PMS-related symptoms. Omega-3 elevates depression, anxiety, and concentration issues, and longer-term use significant results. Vitamin D, again, is implicated in better dealing of the symptoms and aids in better calcium absorption, better calcium harnessing, and improvement in the mood swings, pain, fatigue, and cramps. Moving on, what about menopause? Again, the role of vitamin D cannot be underplayed because vitamin D is needed for harnessing the calcium onto the bone matrix. So increase your protein intake, or at least optimize your protein intake, which is the bone matrix, on which, on top of it, the vitamin D and the calcium is going to act, because menopausal women are prone for osteoporosis and fractures. And not only osteoporosis, the obese the woman is, more osteoporotic she becomes, more sarcopenic she becomes, she is going to have a higher incidence of metabolic disorders such as cardiovascular disease, hypertension, and stroke. So it is important to harness the benefits of vitamin D, protein intake, and calcium intake in the menopausal women more so to avoid the metabolic syndrome and not just osteoporosis. And omega-3 fatty acids, again, reduces the menopausal symptoms like hot flushes and primarily found in fish, flax seeds, and walnuts. So seed and nut cycling is very, very important for women from these benefits of healthy fats, which they So phytoestrogens, this is something which is not very well understood. There's definite effective in reducing hot flushes. The fear about increased breast cancer is not fully evidence-based. You need tons of phytoestrogens to cause increased breast cancer. And decreases the vaginal atrophy, improves sleep and cognition, and positively enhances bone health. And its impact on fracture, basically with the calcium supplementation for menopausal women is at least 1 gram in our population. So 2 glasses of any dairy product will give you if you're like a milk intolerant, you can take buttermilk or curd. And we have non-dairy sources of calcium, such as ragi, your soy milk, as well as your cabbage and sesame seeds, which are there, and moringa kiri, which is a very good source of calcium. So calcium supplementation, either for nutrition or in the form of supplement, is mandatory for patients with menopause and high risk of osteoporosis and osteoporotic fractures. Menstrual disorders, menorrhagia, which is excessive uterine bleeding of more than 80 mils. All women in the reproductive age group, if they're found to be less than 11 grams of iron, will need iron supplementation and need iron-rich diet throughout in the reproductive age group. So the diet should be low animal fat, rich in fish oils, and flax seeds and soy protein as supplementation to reduce the cramping and heavy menstrual loss. Chronic iron deficiency will be caused by menorrhagia and cause menorrhagia as well, because chronic iron deficiency is again inflammatory in nature. So iron-rich foods are wheat germ and liver, kidneys, apricots, ground beef, rice, beans, spinach, and chicken. So increase these in your daily diet so that, and enhance them with vitamin C or citrus juices or yogurt, which help in iron absorption. Do not take them with milk, especially the supplement, because calcium and vitamin and iron do not go together, the chelate, and none of them will be absorbed. Vitamin A, studies show low vitamin A levels in adult women, and when they intake of vitamin A, normalcy and reduces the blood loss in women. What about menorrhagia and vitamin B complex? Vitamin B deficiency is known to can cause menorrhagia, but vitamin B complex can normalize estrogen metabolism. Vitamin C, again, improves the heavy bleeding by reducing fragility, because vitamin C is essential for capillary integrity, and they can benefit women with iron deficiency by increasing iron absorption. We do not totally advocate nutritional supplements because we do not know what ingredients are there. However, these are known to increase the betterment of symptoms with menorrhagia. What about painful menstruation? Is because of a pruritus, and as I told earlier, if it's persistent on throughout the period and throughout the month, do rule out endometriosis and do not dismiss it as a simple dysmenorrhea. Calcium and magnesium definitely have a very positive effect on the dysmenorrhea, and that is because of the uterine relaxant effect of the magnesium. And however, the dose is unclear. Dietary fiber and fat affect estrogen levels. So fiber intake reduces the inflammation because it reduces the estrogen levels. Therefore, consumption of dietary fiber is going to improve the menstrual pain or cramp, which is why I said avoid this carb, avoid excess sugar. A high fiber diet will enhance betterment of the PMS symptoms and reduce the dysmenorrhea and painful cramps. Again, omega-3 fatty acid is beneficial. Fish oil significantly decreases menstrual pain. However, omega-6 fatty acid will be causing pro-inflammatory status and pain. Vitamin D reduce the inflammation and reduce the dysmenorrhea. Oral vitamin D decreases the pain in the severe dysmenorrhea. And vitamin D and calcium intake can reduce dysmenorrhea effect severity as well. Is it important to have breakfast? Yes, breakfast skipping disrupts the circadian rhythm, affecting the stimulation of the other inflammatory processes. So meal skipping impairs reproductive rhythm, leading to ovarian dysfunction. These women who skip breakfast show higher dysmenorrhea and irregular menstruation. And because you do not stick to a particular pattern, there is going to be a further enhancement of the inflammatory process, causing further disruption of the ovulatory cycle. What about fibroids? Are there any nutritional changes or adaptations we need to do about fibroids? We know that being Afro-Caribbean, high BMI, early menarche, nulliparous vitamin D deficiency are all risk factors for having fibroids. So the body weight health study lacks circulating fatty acid measurements. It shows that dietary fat enhances the inflammatory status and fibroid growth. And that is because of trans fat and high fatty acid content of certain foodstuffs. We know that dietary fat increases further metabolic problems and also fibroid size, as well as dysmenorrhea or menorrhagia due to fibroids. Diets rich in fruits and vegetables, fibroid disease, or the impact due to fibroids. Red meat consumption increases risk of fibroids. Fruits and vegetables being a good source of vitamins and antioxidants, along with high fiber and lycopene, reduces the inflammatory process and reduces the effect of fibroids. About strawberries and the anthocyanins, they have anti-inflammatory and antioxidant properties, similar to curcumin, which reduces the fibroid growth, reduces the fibroids. But these have to be supplemented for a long time on a regular. Less dairy and supplements consumed. Dairy foods contain anti-tumorigenic constituents. Milk may increase hormone-dependent tumor risk, so better avoid in patients with already high estrogen levels. So lower serum vitamin D levels increase fibroid risk, as we know. Apart from the food we eat, the food also contains pollutants and metalloestrogens. So these pollutants like phthalates, parabens. So we need to understand the way we cook as well and in what we cook. Microwaving is definitely bad. Grilling and barbecuing, well, especially saturated fats or proteins, disrupts these animal proteins. They're more carcinogenic. Avoiding plastic. There are microplastic in many of these foodstuffs. That also exists estrogen receptor activity, and enhances the inflammatory process and increases the risk of fibroid as well as dysmenorrhea and menorrhagia. So we have to understand not only the presence of macro and micronutrients, but also the pollutants and the metalloestrogen, the way we cook and the what we cook and how we cook as well. Similarly, neoplastic disease also have a big role as nutrition is concerned. And most of them are because nowadays due to the metalloestrogens. And we know that to the gynecological problem are because of obesity, are because of a high carb diet, imbalance in the nutrient metabolism because of lack of autophagy, alteration in the immunity is because of the alteration microbiome. So it's an interplay of various levels of processes, and the most important thing being obesity, which is a trigger mechanism for the various gynecological problems, especially cancers. So lifestyle interventions are paramount. Sleep is very much underplayed. It's a reparative process, it's a restorative process, and that has to be managed well. So diet tips to prevent common gynecological issues is stay close to the source of your food. So consume whole grains, consume calcium-rich foods. Banana, especially the green one, is a very good prebiotic and a probiotic. As consume vegetables and fruits in plenty. Soy products compared to dairy products. Food rich in health, folic acid, because it's prenatally important to supplement enough folic acid, and food that maintains smooth absorption of iron. So reduce your oxalates and increase your vitamin C. It is also to understand each one's dietary behavior so as to modify their diet to be maintained well and not fall back into their default position of high sugar, high fat diet. So it also depends on what each one's understanding of what they know about various macro and micro groups and what they understand about perceived benefits of healthy eating. How do they make their food choices and they prepare their food as well. And it also depends upon their socioeconomic status. We know that easy to buy and easy to easily available compared to fresh fruits and vegetables, but that should not be a deterrent factor, which is why we need to have a strategy by why everyone gets access to, and home cooking, which is a dying art, should be revived so that you cook healthy and you eat healthy. So these are the, again, emphasis on the various pillars of lifestyle medicine, in addition to the nutritional support we offer for gynecological disorders. So recapping what we went through, most importantly, we need to understand nutritional strategies for polycystic ovarian syndrome, endometriosis, supporting menopause, and treatment for fibroids and dysmenorrhea. These are very much underexplored. And not only that, the importance of nutrition in the way we cook, as well as the way we feed our generation also. And observational studies should shift to randomized designs for making meaningful interpretations of the impact of these nutritional alterations, which we offer to the subsequent generations. Association between gynecological disorders and diet can throw on our understanding of these disease processes, and we will be able to maintain a reversal of these disease processes and lesser use of hormonal agents for the treatment of the same. And randomized controlled trials can establish diet's protective or deleterious effects on the women's health. And this is what has been shown by the seed cycling. So as take-home message, there's nothing to replace healthy lifestyle and balance. They're very crucial for maintaining the metabolism homeostasis and preventing any chronic disorders. Nutritional factors and dietary habit influence gynecological disease, amelioration of symptoms, progression of disease, and even reversal of the same. Diets rich in fruits, vegetables, and type of diet, green tea, vitamin D, and plant-derived compounds, and plant protein may positively impact gynecological diseases. Things to be avoided are high fats, red meat, alcohol, and coffee. And data on the association between dietary habits and gynecological disorders can be conflicting due to potential confounding factors. It's difficult to have completely done away with the bias while analyzing these significances. These are some of the references which have been used in this preparation of this. I have learned a lot while going through and researching for this particular talk. And it's all about understanding your macros and micros. It's about understanding your plate. It's about understanding, it's all about portion and not just food groups, mindful eating, mindful cooking, mindful shopping, which goes a great deal on reduction of the factors. Thank you.
Thank you. Thank you, Dr. Meera. That was really, really insightful. A lot of key takeaways, which you've summarized beautifully. And I think across the board, irrespective of the gynecological problem, one thing comes out very, very clearly is focus predominant, a plant-forward diet, is more fiber-rich, which is more colorful, antioxidative and phytonutrient-dense foods. And of course, the nuts and seeds and whole grains have their role to play. We have a few questions, if I can just take them. Dr. Pratima asked, does spearmint help in PCOD?
It's not particularly spearmint tea, any type of avoiding any caffeine will help PCOS to some extent. Alone is not to help. We have to keep understanding the fact that we have to make these choices rather than I take coffee to spearmint tea. Will that help? I don't think so.
Okay. Thank you. Simi says, great talk, a lot of insights. Thank you very much. Can you please on any nutritional suggestions to reduce premenstrual symptoms? Also, any menopausal period, especially after 40?
This is something I learned for premenstrual symptoms. Reduce the amount of carbs you take. There's usually a lot of craving for sugary substance. And once you touch sugar, you more. So a tip to avoid craving of sugar, use mouthwash and gargles that reduce. Your chocolates, which your comfort food at that time, should not be the case. Take more carbohydrates, which are complex. So a whole meal, grain meal, would be better than something which is calorie dense like the chocolate. And reduce the salt intake, because salt makes you cook more, and salt makes you, and that increases the bloating sensation. Magnesium supplementation, especially in the second half, with vitamin B6 is definitely known to reduce premenstrual symptoms, gives you better sleep, gives you better calming effect, reduces the anxiety, reduces the cramps, which are these horses, which are very, some of the suggestions which I could suggest with regards to premenstrual syndrome.
Also, a question on the perimenopausal period.
Most important, be wary of your protein. We can very much slip into this fact we will not taking protein. You lose muscle rapidly after the age of 40. Protein adequately kilogram body. Best way to make that happen is make sure every plate 1/4 is protein. If you're taking a carb portion, have a protein, but have the fiber. Otherwise, we will cut down on our protein significantly, and sarcopenia is one important risk factor for osteoporosis, not the other way around. That is one thing I would like to say on. Majority of the perimenopausal people can have menstrual disorders. So check out on your iron, eat iron-rich foods along with vitamin C, and that is very, very important. And your calcium intake.
Right. The next question, Anjana, is on how to reduce fibroids.
Cannot be reduced just because you take something nutritionally, but you can avoid flare-up of the growth and the symptoms by avoiding meat, avoiding trans fat, and avoiding high-fat content. So avoiding certain inflammatory agents in your diet can help the growth of the fibroids, because these are hormone dependent.
Yeah.
So.
Thank you. There's one question on supplements which women need to take when they're approaching 40 and if they're married latest anything specific?
Definitely folic acid with B12. Many people just do acid. It is not going to do good because if there is a mutation of the take folic acid with B12. Make sure you're not diabetic, and if you're obese, try to be on a low carb, high fiber diet, so that will help you. Plenty of fruits and vegetables will help you, especially if you're approaching 40, because already the fertility is on the decline. If you want to keep your fertility at higher levels, that would help us.
Thank you. Dr. Manas is asking, how can a vegan diet be optimized to meet the increased nutrition, especially for iron, B12, and DHA?
I think we'll have to supplement that, especially in pregnancy, because there's no other way we can.
And across the board?
Even otherwise, yes. See, nowadays we have more B12 deficiency because many people have turned into these dietary practices in dairy. And third, people also have a higher population is currently on other medications which are helping. These are the predominant population which are now B12 deficient. So we need to supplement B12 significantly more.
Right. Dr. Meera says, great talk with gynecology. 44 years old and I get a bad odor in my periods. Does this need attention?
This could be because of dehydration. This could be because bacterial vaginosis as well, especially if you have itching vaginal discharge. This is something to look out for because the pH decline. So supplementing with probiotics will help at that time for sure.
Thank you. Last couple of questions. We want to close it on time. Any herbs which we can include on our daily diet to prevent PCOD?
Exercise, especially if you have a family history of diabetes and PCOS. Out mindful eating, watch, and regular exercise, which will prevent PCOD from the beginning.
Right. So no specific herbs that you're suggesting, like?
I wouldn't.
Use bloating while menopause?
Less fat, less carb, high fiber diet.
So the message is clear across. Focus on a high fiber diet, predominantly having lots of fruits and vegetables and nuts and whole grains and all of that. Just my daughter's 3 years old, prolonged bleeding into 20 days in a month, but it's very little. How to get rid of this irregularity?
This classically shows her endometrium could be thick because of a slightly predominant estrogen as opposed to the progesterone. She could be anovulate. Getting this is important to check on the endometrial thickness. Seed cycling definitely help with the regularization because it enhances progesterone synthesis in the second half, downregulates the excess estrogen in the first half. So seed cycling would be a very good nutrition intervention for this particular index patient or case by nutritional intervention alone.
Thank you so much, Dr. Meera. It's really been an honor and very, very insightful session.
Nuts better so. It's otherwise difficult to eat them.
Right, yeah.
There was a question soaking of different. It feels much more palatable for some reason.
Okay, so nuts and seeds both best soaked rather than eaten in the raw.
And not all of them can tolerate flax seeds. Not all of them can tolerate the sesame and the pumpkin seeds to be okay. But watch out, 11% to 15% of them can have GI disturbances with seed cycling. So see whether you're able to tolerate it, because that itself could give bloating and you will achieve PMS.
Thank you so much. We don't have any more questions, and I think with time. Really an honor and a pleasure to have you, Dr. Meera.
Same here, and thanks for having me here.
Insightful things. Thank you so much.
Thank you very much, Dr. Meera. It was very informative, very answering the questions as well. Thank you
so much. Thank you.
Very
I
happy
learned a
Diwali
lot.
to everybody.
Yeah, a happy, healthy Diwali for everyone. And
Yeah.
I learned a lot on this behest. Thank you.
Thank you so much.
Thank you very much.
Bye-bye.